Right, so I'm going to talk you through some various different tapes that we use, both in the clinic and in a sports setting like a rugby pitch. First tape that we use that's important is the Hyperfix tape. This is important because if we used any of these other tapes on bare skin, it will just slip off, particularly in high impact sports like rugby, football, hockey. So we use the Hyperfix. It needs to be cut to a certain length. It's nice because it's split in two, so you can easily peel, and then you can use one or two halves of the Isofix tape. That would be placed directly onto the skin. The top of the Isofix tape is a great texture for holding other tapes on. So yeah, this is known as your anchorage tape. So this one is called EAB tape, elastic adhesive bandage, and it does what the name says. It's stretchy and it sticks very well. The reason we need it to be stretchy is if you have joints that just need a little bit of support, things like knees or elbows, it's great because it doesn't restrict range of motion too much, but it gives it a nice compact feel. And it can also be used with these other tapes that we'll talk about later to keep them all nice and tight, nice and locked in. So you can put things like the rigid tape on top of it and then put this on top of that. So these two are zinc oxide tapes. Particularly this one is used a lot in combat sports like rugby and American football. It's really good because it's non-stretchy. If you want to pin a joint in a certain location, you'd use this tape and you'd attach it from something like this adhesive tape to another area, and that would stop the joint having a lot of movement through it. So that's really useful when you've had things like AC dislocation, ligament sprains and stuff like that. So this is kinesiology tape, always comes in fancy different colours or patterns. A lot of people know it just because of the brand Rock Tape. They really put it on the map. It's commonly used for a proprioceptive aid, so really good for things like ankle sprains. So you put the tape on the lateral side of the ankle, and then as the ankle starts to deviate, you get a proprioceptive feedback from the tape. So then you correct the ankle quicker than some of the damaged ligaments could possibly give you that. So that's really useful. It's very sticky, easy to apply to skin. Top tip when you're applying it is to always round the edges, and it just doesn't peel at the corners quite as much.